reopen schools now with scientific evidence on the effects of school closures. This is a part of ADB's South Asia Human Development Matters seminar series, jointly organized with ADB's education and health sector groups. So, in addition to being a health and economic crisis, the COVID-19 pandemic has also turned out to be one of the biggest education crises in recent memory. In particular, the question of whether and also how to reopen schools are burning issues in nearly all countries. So today we are happy to have Dr. Hyunchol Bryant Kim, who goes by Bryant, who will share his insights focusing on the first question of whether to reopen schools now. So Bryant is an associate professor in the economics department at Hong Kong University of Science and Technology. He is also an assistant professor in the Department of Policy Analysis and Management at Cornell University in the US, currently on leave. In addition to a PhD in economics from Columbia University, he holds an MD from Yonsei University in Korea and a Master of Public Health from Seoul National University. So with degrees in medicine, public health, and economics, he aspires to be a social doctor and focus on causal impacts of policy intervention in health and education sectors. Indeed, he is currently engaged in multiple impact evaluation studies with ADB. So before I hand over to Bryant, let me talk briefly about the logistics and structure of today's webinar. So Bryant will present for 30 minutes, after which Eduardo Banzon, or Dodo, a principal health specialist in ADB's Southeast Asia department, will share his reactions to the presentation. Then we will open the Q&A session. So participants can enter questions in the chat box, but the chat box will only be enabled once the Q&A session begins. And I will moderate, pick out questions based on the order in which they come in. So thank you very much for your patience. Over to you, Brian.
Yeah, thank you for having me. Again, my name is Hyunchol Bryant Kim. I'm working at HKUST and the Cornell University. And the title of this project and this conference is The 5 Reasons to Reopen School Now, the Scientific Evidence on the Effect of School Closure. Before I talk about the school closure, let me discuss a few things related with school closure and reopening decisions. The first, how long COVID-19 crisis will persist. In my view, the war against the COVID-19 is still in the first half. I'm very sorry to be pessimistic, but some expect that the vaccination will bring our life back to normal within a year, within 2 years, in the developed countries. But this is the most optimistic scenario with many assumptions. Like the first of all, vaccines must be provided enough, which is far difficult things for the developing country. And more than 60 to 80% people should be vaccinated within a relatively short period of time to get the herd immunity. This is also difficult challenges, not only for the developed country, but also for the developing country. And another one is that vaccination should be effective for relatively long period of time. The scientists expect that that's going to be like less than 1 year, but nobody knows yet. And people wear the mask even after the vaccination, which means that there is no risk compensation. If people try to remove the masks after vaccination, then the protective effect of the vaccination will decrease. And lastly, vaccine would work for the new variants, which we don't know yet. So under this assumption, everything satisfied, then the war against the COVID-19 will ends within a year or 2 years. But this is a super strong assumptions. It means that for the developing countries, even for the developed countries, it would take at least several years to finish the war. So the question is that, do we have to close school like 2020 in next several years? And how much Yeah, and the next slide is the how much countries close schools so far. Um, According to the UNESCO, it's the average 22 weeks. Like school closure is the average 22 weeks in 2020. Um, it is for the member countries for ADB. Central and Southeastern Asia is 27 weeks, and Eastern and Southeastern Asia is about 22 weeks. So last year, about 6 months, more than six to 7 months, schools are closed. And there are two different views on school closure and reopening. Some people agree that um, um, children stay at home during the pandemic. For example, Philippines President Duterte wants kids aged between 10 and 14 to stay inside home. A couple of weeks ago, he mentioned that children should stay home and watch TV. And some people do not agree. For example, UNICEF chief executive director said children cannot afford another year of school disruption. Today, I will talk about why we need to open school now. More specifically, I will provide an evidence to allow us to reach the such conclusion. In terms of how to open schools, there have been discussions how to open the school. So here are some informations, but I will not going to talk much about how to open the school, but I will focus on why we have to open the schools. So here is the summary for some people who has to leave early. There are 5 reasons to reopen the schools now. Number one, school closure appears to have no impact or minimum impact. Also, it has huge damages for our children in the society because they are losing all the positive effect of the education. These two are way enough for us to make a decision to close the school. In addition, children are much less likely to be infected by COVID-19. And school restriction intensify inequality and also put the mothers and grandmother at risk. So these are the reasons we have to reopen the school as early as possible and as much as possible. Okay, then I'd like to provide the 5 reasons one by one. First, closing school appears to have no impact. There are 2 types of studies looking at the impact of school closure and reopening on the prevention of the spread of COVID-19. Number one, the first one is to measure COVID-19 incidence before and after the school reopening. If the study would be robust, if study has a control group. Control group is the other district without the change of school closure and reopening. So one paper, I will introduce one paper done in Germany. Another study is to look at where students get infected when the schools are reopened. There are a couple of papers, but these 3 papers are the best paper that I have found. So let me introduce one by one. But although I try to find the evidences, like scientific evidences, robust evidences done in developing country, but unfortunately, I couldn't find it. There are a few evidences, but these are all not robust. So we will discuss the robust evidence and think about how it could be applied for the developing countries. So the first study is done in Germany. These are the timelines of COVID-19 pandemic and school closure and openings. So during the first peak, all entire schools are closed in Germany. But after summer break, schools are fully opened. But we find that COVID-19 cases increases over time after summer break. But the question is that, is this increase due to school opening? Answer is we do not know. Why is that? There are so many other factors that affects COVID-19 incidences. But the beauty of the German case is that very interestingly, German schools opening dates are all different by across the counties and states. So these dark the states and counties, these are the schools. These are the districts to open the school in each date. So some counties, they reopen the school fully in August 3rd, and some counties, they open the school late, like 27 August and up to 14th of September. This provides us a good opportunity to study impact of school closure on the spread of the COVID-19. And these are the outcomes. So the vertical line is the school opening date, and these lines are the impact of school closure on incidence of the school reopening, on the incidence of COVID-19 cases for each age group. Okay, so what we can see is that there are even negative impact on the incidences, those who are aged between 0 and 14, and same findings between 15 and 34. But there is no changes for the people aged over 35. And the authors argue that at least school opening do not increases COVID-19 cases. Another study is looking at where these child and adolescent infections after reopening the school comes from. The first study is from South Korea, and they look at after reopen the schools, and they look at where these people get infected. So these are the outcomes, and only 3 out of 127 confirmed the people aged between 3 and 18 are from the school. Most of them are infected from their home and multi-use facilities like restaurants. So very few, like less than 2%, less than 3%, 2% of people, 3 cases from school. Look at Australia. This light green bar is the total cases over time. And the dark green bar here is the cases, those under 18. And as you can see, the incidence for those under 18 is very low. And the next figure is at the bottom, shows that where they were infected. And dark greens are outside the schools, and other colors from inside the schools. These are all shows that after reopen the schools, most cases are from outside the schools. Inside the cases inside the school, from the school, is still very rare. Another study is from Italy. Schools are open in Italy since September 2020. And after the reopen the schools, only about 2% of the schools, 1,200 schools out of 65,000 schools has positive cases, COVID-19 positive cases. But with this 1,200 schools, 90% of the schools, 1,100 schools, has only one cases, single cases, not from the school, but other, like outside the schools. And only one schools out of 65,000 schools has more than 10 cases. So within school transmission is super limited, super unnecessary, very unnecessary in Italy cases. Similar experience in US. only 7 out of 191 students and teachers were infected within the schools during the face-to-face school periods. The only exception that shows that potentially positive COVID-19 instance is from Israel. Israel scientists, they report that after COVID-19, after reopen the schools, COVID-19 cases gradually increases, but they at the same time they observe that this is not associated with hospitalization and deaths, which is more important, I think. People are like stick to the number of cases, but more important one is that the more serious cases that potentially translated to death or serious complications. But school close, although Israel finds some positive associations between school reopening and the number of cases, number of COVID-19 cases, but they do not find evidence that these are related with hospitalization or death. Okay, then why school closure is not helpful? So this is the most important concept that I would like to provide you today. And this is the most important thing in my presentation. So this is this. Students not going to school doesn't mean they stay at home. If they meet outside the schools, if they meet friends outside the schools, school closure is meaningless. Maybe the school that follows social distancing can be safer for children. So these are the comparison. School closure, what do? They meet the friends at home or at the playground without mask, without any supervision. But if students go to the school, they wear masks under teachers' supervision. So these are maybe I a little bit exaggerated, but if they come to school, at least we can control for them. But if they stay at home, if they do not go to the school, that does not necessarily mean they stay at home. They meet the friends. It is almost impossible to prevent them do not go outside the home. They meet the friends without mask. Okay, so that's why most of the evidence shows that school closure has no impact on, or even negative impact on COVID-19 cases. And let me think about the developing countries. Evidence are mostly from the developed country. So let's think about the developing country and developed country settings. Developed country setting, maybe school classrooms are more crowded, which is less favorable for us. But in terms of ventilation, maybe it's also possible for developed country to ventilate the classroom pretty actively, and we also able
Hello?
to. Yeah,
Question.
yes.
Pag, um, pag may na IBS,
Hi, could I request everyone in the audience to mute their microphones, please? Thank you.
Yes. Is the question is from after the presentation or during the presentation?
The questions will be after the presentation and
After the
after
presentation.
reactions
Yes.
from our principal health specialist.
Okay. Yes. Yeah. So please provide the questions in the chat box. I'm very happy to discuss after this. So I think it is super important to provide enough masks for the children when we decided to open the schools. This is very important, and also we have to make every effort to lower the density and keep the maximum ventilations. So these are very important, and there is a very nice illustration for the impact of the ventilations. Okay, the next one is how big is the loss of opportunities for the children. So the impact of there are many evidences that the positive impact of education. But basically, not going to school, we are losing all the positive impact of education. What are the positive impacts of education? First one, big impact on labor income. So this is the evidence, but from the James Heckman, very recent evidence, the Nobel Prize winner of the economics, couple of years, 10 years, more than 10 years ago. He looked at the impact of high quality early childhood educations, which is ABC or CARE. They found that when they turn to 35, they randomly provide the early childhood education. The program beneficiary outperformed non-beneficiaries in all dimensions, like education level, total education levels, employment rates, wage, and health outcomes. So I think it's better to show this diagram. So these are the income dynamics. So the dark line is control group who didn't attend the high quality early childhood program, and the gray line is those who participated the program. They find that on average 10% differences in terms of wage. So only for the 2 years of early childhood education programs would increases 10% of income when they become adults. Not only income, but also health behaviors. Education lowers the likelihood of smoking and heavy drinkings. And they allows the people to meet the better spouse. More educated meet the better spouse. It also decreases mortality in the end. This paper is look at the impact of impact of school mandates, elementary school mandates on adult mortality in the United States. It's from the increases of education is from 1910. So 1910, like 100 years of United States, is no better than the developing country nowadays. When they increases educations about 1 year, the primary school education increases 1 year, it translated to 1.7 years increases of longevity in the United States. So that is another evidence. And this is from my recent paper. We randomly provide the 1-year secondary school scholarship program. We find that the CCEI is how do they make a better financial decision? And we find that they make a much better financial decisions. And this is also from my paper. And like these secondary school education helps students to have a desirable personality, like extroversion, agreeableness, conscientiousness, emotional stability. Those who are treated for the 1 year of secondary school education, they have much better personal characteristics that helps them to perform well in the labor market and in the society. But this is also important. Non-cognitive ability or personality is also important in our life, but education really helps them to have a better personality, non-cognitive abilities. And also, education increases use of contraceptive and decreases fertility in developing countries. So these are the correlations between years of women's education and total fertility rates. Okay, so it helps to have a better family planning. The last one is mother's education affects child health. So these are evidence from US more than 50 years ago. So 50 years of the United States, average income is about the same to our member countries. And they found that people who educated more, the woman educated more, their children have better health, like their birth rates increases, prenatal care, they're more likely to get the prenatal care, they're less likely to smoke during the pregnancy, and their husband education also increases. So education has huge impact on our life. but they are losing these positive impacts of education. Okay. So some might think online education can replace regular school classes. However, many adults like us struggle to concentrate more than 1 hour, more than 2 hours. If I talk to you more than 2 hours, 3 hours, nobody can concentrate. Students who do not have guardian at home during the day, they are almost neglected nowadays. Furthermore, online education has limited impact on the development on non-cognitive skills. So these are evidence from France and Italy. So lockdown itself decreases test score by 5 to 8%. But there are states who are actively use the online lectures, online communications, and these compensate just a little bit, but decreases, but like without online lecture, it decreases by 5 to 8%. But those who receive the online lecture increase only by 1 to 2%. So online lectures has limited impact. It's not replaceable to the regular face-to-face lectures. So these are the outcomes. So decreases by, because of the lockdown, school closure decreases by 5 to 8% points, but online lecture only compensate only just a little bit. That's an evidence from France and Italy. But think about the developing country. Oh, one more. What about emotional status? Emotional status scores decreases by 0.2 or 0.7 points, but online lectures do not compensate anything. These are not all non-significant, except for this. So that's an outcome. And let's think about the developing country. So developed country, these are from UNICEF. High income countries, about 80% have internet access and computers. But if you go to the lower income country, only 20%, right? So distance learning in developing country is unlikely, is super limited. As far as I know, in Philippines, they try to provide lectures through radio. And imagine how long they can focus on. It's not even comparable to face-to-face lectures. So online or distant learning is super limited, even in the high income country. But if you think about the lower income countries, it's almost nothing. It's almost super limited. That's my view. So far, two evidence is enough to provide to provide the rationale why we have to open the schools, but the rest of them are less important. Another evidence is that children are much less likely to be infected by COVID-19. So these are the figures. The mortality is focused only on age 60 and over. Okay, so COVID-19 risk is for the elderly people, as we know. And these are the incidence and mortality from Philippines. Think about the population structure first. Most of them, like majority of them are below 20 in Philippines, but incidence is, majority of them are aged over 20, and mortality, those concentrated in 50 and over. Like developing country, maybe the lack of the limited resources, the incidence of the mortality is higher for the aged people 50 and over, but developed countries more like these are concentrated people aged 60 and over. Okay, even in the Philippines, the mortality or incidence for those below 20 is very low. And for the children, especially those below age of 12 and 14, they are less susceptible. They're less likely to be infected. They are much more likely to have mild or no symptoms, and they are less likely to pass the viruses too. Okay, so children are much less in risk. The last two evidences are simple. School restriction intensify inequality. The decreases of here is an evidence. The decreases of evidence are concentrated. Those mothers' education is lower and less likely to get the financial support, which we can expect, right? So mothers with higher education, they can try to compensate the lack of education by teaching them by themselves. If they have more money, they can find outside resources. But people who do not have money, they cannot find any resources outside the schools. That's why it intensified the inequality. And also, the school restriction put the mothers and grandmother at risk. So these are U.S., but the labor supply decreases is higher in women than men, and also the lockdown, the child care burden increases because of the school closure. And the school closure also increases interaction between grandparents and children, especially for grandmother. If the parents has to go to work and the children remains at home, what do? They probably ask their grandparents, especially grandmother, to take care of the children. Which means that because of school closure, the interaction between children and grandparents increases, and they are more risk they get more risk. Okay, let me conclude. School closure does not help prevent the spread of COVID-19 and causes tremendous damages to students and the society. And school reopening should be the top priority for all countries in 2021. Thank you.
Thanks a lot, Brian. Just on time. Thanks a lot for the very useful and telling presentation, especially on the opportunities lost due to school closures. And that was my timer. Sorry about that. So without further ado, I would like to pass the floor to Dodo or Eduardo Benzin, our principal health specialist, for to share his reactions to Brian's presentation. Dodo, over to you, please.
Okay. Sorry. Thank you. Can you hear me? Okay.
Yes.
Okay. Hi, Brian. Nice to see that you are in Hong Kong right now.
Yeah.
So I think I fully agree with the evidence that have now evolved, that in a sense, school closures is not only affecting the education, but it's actually creating really adverse health outcomes in the future. Okay, fully agree that the options of moving into online schools will not address a lot of these adverse health outcomes, a lot of the health issues that are now arising brought about by school closures. So I think the challenge really we have is how to balance this. I think this goes beyond really health outcome story, but really a political question. Okay, part of what we are hearing from DMCs is really an apprehension of political leaders to expose children, even if the risk is that small. So it's so just being put in a position where you bring the kids back to school and then they get infection. And I think we saw that in Israel, even if the numbers were small, politically they had to get back the schools out of schools again, even if the numbers and the evidence were not really showing a spike. It was just it was an expected increase in numbers of COVID-19 that happened. So I think that's really the challenge for us. To what extent can political leaders and decision makers accept that at the end of the day, the risk, the disadvantages of schools closure is much higher than keeping the schools closed. But to what extent can they actually communicate that once they open up, that reduced risk of infection, which is there, which we could not deny is actually there, is something that should be acceptable. Over to you. Thank you.
Oh, great. Dodo, I fully agree. So the school infections after school reopen should have happened outside the school, right? If we reopen the schools, if we suppose that we close the school, they meet the friends outside. So this the incidence of COVID-19 should have happened outside. So although there are some cases at school, they like close the school, do not reduce this incidence. That should have happened outside the schools. So that's the point. But the concept of the counterfactual may be difficult to convince the government officers. But like we should have provided the scientific evidence. That basically I'd like to share this screen once again. Yes, so I hope like everybody can see the screen. So basically, we are not comparing going to school versus stay at home. These are comparing going to school. Reopening means going to school versus children at friends' home or the playground without mask. That is something we really have to communicate with the government officers. Maybe that's my reaction. Thank you.
Thank you, Bryant and Dodo. Dodo, did you have any more remarks?
Rick, I'm already convinced by Brian.
Thank you.
Thank you.
All right. So thank you, Dodo and Bryant. For all the participants, the chat box is now open. So you can enter your questions in the chat box and I will pick and relay the questions. So the Q&A session is effectively open now. It will go on for about 15 minutes. So please enter your questions in the chat box. So while we're waiting for the questions to pour in, Brian and Dodo, I will start with one question. So, you know, the reasons that you give for reopening schools is, it's convincing. Like, you know, we understand the repercussions that school closures have. And you know, as the current slide on the screen shows, if children are not meeting friends in school, they are meeting friends outside of school. Although one could argue that, you know, the scale of exposure might be significantly lower if they're not going to school. But like, you know, I'm looking at the pictures of the classrooms and, you know, there is a lot of inputs required, right, for safe reopening of schools. So, you know, could you talk about, you know, what are some of the minimum conditions that would need to be in place for countries, developing countries in particular, to reopen schools right now?
Right. So evidence is clear, and the challenge is that would it be possible for us to prepare enough masks for the students, and how we decreases the density of the classrooms, and how we protect the teachers, right? So these questions are still remain. So, but the webinar is not focusing on this, but this is something we also have to discuss. Maybe ADB can consider another webinar that focus on how to open the schools. But the many countries, like for many countries, are like available. The masks are available, and when the vaccine available, teachers we can consider teachers are also priority on the vaccinations. Yeah, I hope this this helps. But we also can consider take the classes outside the classrooms, right? Divide by the classroom by half. Half of them take the classes in the classroom. Another half in the playground. Sorry to say that, but this is another possibility. Um, yeah, but we can discuss. Right, we should be creative to make things happen.
Uh, Hello. Sorry.
Thank you, Bryant. Is that Dodo?
Yeah, it's the other.
Yeah.
I think part of our challenge really, moving forward, sorry, uh, is 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 the fact that a lot of the literature that Brian presented really does not involve DMCs yet. And in a sense, that's a challenge because as we talk to political leaders in DMCs, they will always argue. Well, it has been argued that schools in DMCs, for example, are more crowded, okay, compared to, for example, in schools in Italy or in Korea. Whether that's more just anecdotal or there's empirical evidence, I think that it would be nice to resolve that. Also, or the travel between schools, because as Brad Brian said, okay, the risk really sometimes is not in the school because that can be mitigated, whether you're crowded or not. But the fact that how to control the kids the moment you allow them to go to school to start going to malls. And we're talking of a setting in the Philippines and probably in a lot of other DMCs. So I think this is where I call on Brian. Is there a study is there a study approach? Brian for me as an impact evaluation expert. Is there a study approach where we could historically, not prospectively, because we might not have that, try to look into how COVID have actually caused infections, to the extent that infections have happened in schools in developing countries or some of the larger crowded cities. Having those type of studies done, right now we look at the timeline. We're March, right? The schools most likely, most of the schools will not open this semester, this school year anymore. So that means really the target is August, September for a lot of our countries. So is there something we can do in April, May, June, where we could rapidly do either retrospectively or prospectively to look into the impact of COVID in schools in DMCs? So if we could actually do that work, or that can be done with our friends from UNICEF, the UN, and others, that would, for me, be stronger messages that can be presented to decision makers. Over.
Right. I do agree. Yes. Is there any? I mean, I saw some studies done in ADB, but I've never seen the very rigorous studies. The impact of school closure on COVID-19 instance at the same time, academic achievements, right? So we have to look at both of them, but I've never seen it. But we have time, so we can do it very quickly, like to collect the data and writing our reports.
Thank you, Bryant and Dodo. And I believe that also touches upon some of the questions we had from Petite about managing adults movement once you reopen schools, and the question is Esuke had about managing some of these PPEs, masks, and sanitation materials that are required. We definitely need to think about these inputs, because in the absence of these measures, it would be very difficult to convince governments to reopen schools and risk the lives of students and teachers. So moving on to the next question, I know Dodo, you touched upon the optics of announcing school reopenings and the political economy side of this debate. But Susan Roth has put in a question that the evidence is clear, but let's come back to this again. What are some ways in which we can convince government leaders and politicians?
That's a good question. Yeah, not good question. It's a super important question. So let me explain what I have done in Korean government and Hong Kong governments. Um, I write a paper, the newspaper opinions and political the reports that the politicians can read to provide an evidence, the evidence like the evidence of the school closure, and at the same time it is super important to explain the populate the people that there is no zero risk option, right? Like the risk is everywhere. Like not sending children to school does not necessarily. I mean, it's not zero, no risk option. Like we have to face the risk, and the decision should be the decision should be lower, like the comparing the ways and pros and cons of the our decisions. Um, uh, but that's my view. But there should be more interesting and great ideas how to convince the politicians. Especially in Philippines, I'm a little bit surprised that the president has a very strong negative view on school reopening. So especially in a country like a Philippines, the like approach must be super careful.
Oh, hello. Sorry.
Yes,
Uh,
Dodo.
I think one option that seems to be emerging in this vaccine story is an approach that can be considered. Uh, I don't know whether this will work. Probably, Brian, we should do an impact evaluation on this. But what if you open it as a voluntary approach? You know, that means if you call on, for example, in particular areas and say, okay, those that are willing to go back to school, both teachers and students, if they will volunteer, then you start bringing them in. So that will mitigate the political risk of politicians being, when somebody dies, being told, "Oh, you mandated us, you forced us to go back to school." So it's so in a sense, this designing this as a volunteer, I know it's going to have implementation issues. You know, you're going to have you'll have two batches of students, one in schools, one outside schools. Is this something really feasible? But given the fact that, I think really need this could be something that can be explored, studied. Uh, it might not work, but this is one of the things I'm looking at. Second, of course, is something that has always been in the table. For example, even in the Philippines, and I think in a lot of other DMCs, a lot of areas in rural areas in the Philippines do not have the extent of COVID cases that you have in urban areas. There's just not enough concentration of people for the virus to jump so quickly from one person to the other. And this is probably the same story in a lot of other rural areas. So can we start doing that? Whether we're talking in Philippines, Indonesia, or other countries that still have not opened school, really allow schools to open in island provinces or in mountainous provinces where you do not really have the COVID cases, rather than have a same approach that when you open school, you have to open everywhere. So I think, and that has always been on the table. And I think the longer I strongly think that this is something that can work for in the next school year for a lot of countries that will start opening schools. This approach of this is a risk mitigation approach anyhow. So yeah, so this will be two ideas, that two things that may be considered: a voluntary approach to opening, and let's divide countries into where the risks are lowest, then mandate it there if we want the mandatory approach. Over.
Thank you, Dodo. I believe some countries are already practicing this approach. I think Indonesia has marked these like green areas or green zones, right, that are less dense, where schools have already opened. So thank you for sharing your insights. Now, while we're
And
still on
I
the
gotta jump in there. if it's actually happening now,
Uh-huh.
Brian, we should go there and do an impact evaluation because now we'll have two arms, right? We'll have a control arm and
Uh-huh.
a study arm. This will be the perfect setting for impact evaluations.
Sure. Thanks, Dodo. So while we're on the topic of optics and feedback on school reopening, we have a question from the audience. The participant wants to know which countries have already reopened schools, and those that have uh, reopened schools, what has been their experience in terms of parental feedback, and I'll also add to that maybe feedback from teachers and other stakeholders of schools. Brian, I think this question is for you.
Oh, I didn't expect that. That's my that is for the question for me. Yeah, I've been, travel is restricted. I never get a chance to travel a developing country after COVID-19. So, is there anybody who shares
Um,
the people's reaction, the parents' reaction when they reopen the schools?
Brian, perhaps you could also share your experience from South Korea, or if you also if you know what the reactions, if any, have been
Okay, so
right?
yeah, I'm a South Korean, but I do not live in South Korea. But with the mass media, I am actively fighting against the idea on the school closure.
Mm.
So we play much with the news media, and very interestingly, about 4 months, 4 to 5 months ago, people favorable for the school closure is 70% in Korea. After we work a lot with the mass medias and tell the people through the mass media, our school closure is useless, and we deliver the message as much as possible to the population, and these numbers flipped. So now more than 70% of South Korean people are favorable for reopen the schools. We are very grateful on this, and that actually changed the government policies recently. So they try to maximize the school reopening days and the time. So that's the experience that I can share.
Uh-huh.
Yep.
Thank you, Brian. So, moving on to the next question, Ryotaro is asking, like, clearly this is a topic where it's a burning topic, right? And a lot of countries, parents, teachers, other stakeholders in the system are very keen on this, but the number of evidence is still quite limited, especially from developing countries. In your experience, in your research, you know, do you know what are the factors that what are the factors behind the limited research so far on school reopening?
maybe a few reasons. COVID-19 incidence data quality. Even in the developed country, there is an issue how much we can believe it. There are so many infected people who are not detected as positive cases, right? Even US, many people has a symptom, but do not go to the test center.
Mm-hmm.
So maybe the developing country, there is a data issue, how much we believe the incidence of the children, and the children that often have no symptom. So so it is difficult to find the real number. The only reliable source is the probably mortality data. Excess mortality data is important because even in the developing country, the mortality data is reliable. Like they should know these people die or not. So so that's the challenge. But given the data limitation, but, uh, we should have studied not only for the COVID incidence, but also for the mortality. And I would like to propose the education team to look at the test scores. What I found, what I'm very angry for the Korean government and the Hong Kong government is they do not study the impact on the test score. They just say that, oh, there is a negative impact on the test score. But what I found is that there's only two countries to look at the test scores. If you find any papers, any researches to look at the impact of COVID-19 school closures and online teaching on the test score, please share with us. I find only two countries that I have shared today. So yeah, this is something we can do.
Uh, yes, thank you, Brian.
Hello.
Um,
Yeah. Can I jump in a bit there?
yes, please, Dodo.
I think part of the problem that we never saw the research in schools is that I think this is like a whole COVID-19 story, right? We never, most of the focus has been on those who were getting affected and dying, and the children were not dying. They had the cases, and if ever the children, stars of children goes up, it was a story of, okay, we have children getting COVID, a few children. So it was more from really a COVID-19 infection story, you know. And so we sort of, in a sense, the story of the impact of schools to children was sort of left behind. And frankly, even if we start talking about the vaccination story, people forget that the vaccines that are being approved right now are not for children. Okay, as the Pfizer vaccine is 18 and above, as the Zeneca is 16 and above, and not because that we don't know whether they work, it's because the studies were never done for children. And now we start talking about we will open the school when vaccines come. Vaccinate the children? No, because how can you vaccinate when it's not even indicated for children now? So really, it seems that because children are surviving COVID, right, even if they get infected, it's like it did not become a priority. So I think really, I don't know. I UNICEF are my friends, right? But I think they did not shout hard enough to get the global players and countries to really look at the impact of COVID-19 on children. And at the end, this is really what we should be doing now. Really, again, as I said, this whole line that we will only go back to school. I don't know whether this is Philippine specific. I have not heard this from other countries. It could be there. I have not followed this. But if this is the line that we're hearing, that schools will only come back when vaccination happens, then we better be sure who are we talking about when we talk about vaccination happening. We'll wait for the children to be vaccinated. That's 2023, 2022. Because that's when we don't, as I said, we don't even know where the vaccines work for children right now. If we're talking about herd immunity, then we better be specific about it. And we start talking herd immunity, then really we could bring the children back to school much earlier. Because the whole logic of herd immunity means the infection is not spread. So if you could prove that empirically, then bring them back now. So lots more talk. This is going to really involve a lot more discussion. And I also blame myself because I have not also. Look, I probably enjoy having my kids in the house, no traffic. The only problem is they keep on ordering takeout. So it's been quite an expensive homeschooling for them. I think I'll stop now.
Yeah. Thank you, Dodo. And talking about, children's infections rate, there's a question from the audience who wants to know, is it true that children, while not prone to getting infected, may be asymptomatic carriers of the virus and could potentially pass it on to other family members? And, I've been hearing that though infection rates are lower among children, apparently in the case of the UK variant, infection rates among children are also higher. I don't know how much truth there is to that, which Dodo can probably confirm. But adding on to this question, Brian, one of the reasons that you had outlined as a reason to reopen schools now was about the risk to grandparents, right? But in some countries, I can think of South Asian countries where people still live in non-nuclear households, which
Right.
means that, children, parents, and elderly people live in the same household. So if children start going back to school, and if indeed they may be asymptomatic carriers of the virus, but just may not be tested because they don't exhibit symptoms, could this pose an additional risk? And how should governments weigh this risk when thinking about whether to reopen schools or not?
Right. So again, I think it's a like reasonable concern. But the question is that, like, again, if we close the school, do we prevent the child infection? That's the question. Again, going to school, our decisions are not between schools and stay at home. Again, it's going to school versus play at the playground, meet other friends without mask. Right? So maybe like people often misunderstood that, like not going to the school means stay at home. No, they have exactly same risk or even bigger risk if they do not go to school.
Mhm.
So that's the key point.
Mhm.
And so that, of course, children are still get infected. They are possibly transmitted the viruses, although they are much less likely to pass the viruses. Here's an like Lancet evidence, but still is possible. But our decision again is not between stay at home versus school. So basically the risk is remain the same, uh, even for the non-nuclear family.
Okay. Point well.
Monica, I think the challenge there is just what Brian said.
Mhm.
It's really not the infection of the children. It's really the infection with the nuclear families.
Mhm.
Okay, and because that's going to be the argument that will be raised in the MCs. The studies of the West in developed countries have the nuclear family is quite small. Nuclear families in developing countries in Asia are huge, are quite substantial.
Mhm.
So for example, I heard this before that for those in Southeast Asia, because the nuclear family is so broad, is so wide, the infection is actually higher than that in, for example, in Pakistan, where the nuclear family is quite tighter. People usually move out of the household. So this is the kind of studies we need to really rapidly done. And I think for specific for the Philippines, because the reports were picking up from the recent increase in cases, the Philippines is now seeing a new uptake in cases. Okay, so those who are in Manila, let's all be careful. But what we're actually seeing, I'm sorry, this is empirical. Sorry, this is not empirical. This is anecdotal. But I might have shared this because I really haven't seen the numbers. But this was shared by the Department of Health, the Undersecretary, that they're now seeing cases of families coming in infected, and not just individuals. It's
Mhm.
not just a member of one or two members of a family, but actually a whole family being infected. So how accurate this is, or is this is something just by coincidence? We still need to look. We're engaging, but if this actually happening, then this will be something that will go against the push for opening of schools. So really, we need the empirical evidence as
Mhm.
not on the transmission among children, but really within nuclear families in DMCs. And I don't think that would not be I think that's something doable, something we could all sit down within ADB, as I said, with our friends from the other developing partners to start doing that in East Asia, Southeast Asia, and South Asia.
Mhm.
Over.
Thank you, Dodo. There indeed is, clearly a need for more and better empirical analysis to answer the right
Right.
questions. As Lynette has shared from the audience that our ADB-DMC governments are seeking validation of the external validity of the empirical research that we hear from other countries. So, in your and Brian's point on the need for uh, more rigorous and relevant empirical research is well taken. So, I have one specific question from Shin. And this relates to a particular slide in Brian's presentation. Shin, if you are there, actually, would you like to pose your question?
Thank you, Unica and Brian. Yeah, thanks for Brian's presentation. It was very inform. Okay, okay. Okay, yes. Yes, so thanks for this and learned a lot. Just a question about the slide of the effectiveness of the distance learning. So I hope to know like what is, you know, what are the factors you have taken care of, you know, in the analysis. Because, you know, like I was really comparing this like with some earlier, you know, like studies on the effectiveness of IT in education. So that was years ago, right? Like, you know, from that kind of that earlier, you know, evaluation, like the usual, the result was like it was not much effective, you know, for the IT in education. But at that time, the IT in education, you know, intervention was mostly from the hardware side, like providing schools with the IT equipment or this. But then later on, the literature changed a lot. So developing capacity as well as many other aspects, you know, like people are not sticking to that result anymore. So it allows me like to think about, you know, like how we regard, you know, like this effectiveness of distance learning. This might be the first year that most of the countries are practicing distance learning, you know, suddenly. It's an exogenous, you know, impact on them. So however, most of them may not yet be adapted to using this, you know, as a compatible, you know, for teachers to teach and the students to learn, and even for, you know, parents to support. So it will be good for us to know what are the factors like considered in that analysis, and then, you know, it will give a direction, you know, like for, you know, it will be good, you know, at this moment, not to discard the distance learning, but to see how to improve its effectiveness, because we shall not take this COVID-19 as just a you know, like one event that just happened now, and it might, you know, once once the COVID-19 may calm down or disappear, then we might forget that we shall build up this capacity, because distance learning shall still be a, you know, like at least a complementary way, you know, to the routine schooling. Yeah, thank you.
Right. Yeah, I think it's a really important point. Then the evidence from the evidence of the distant learning or adaptive learnings through the tablet PCs or computer, these are all like supplementary supplementary interventions, which means that when you are using the tablet PCs in the classroom with the teachers with some supervisions, then and with relatively short period of time, like 2 hours per day with the teachers, that maybe like facilitate the learnings. But this setting is totally different. You are staying at home without any supervision. Your parents go out and taking the online course through computer, like almost impossible even for the adults, right? Can you so the anecdotal, like some evidence saying that after 2 hours, children are like they lose any concentration power and they do not focus anymore. I can see even in the university students here, so that's not super surprising. So we have to distinguish the evidences where when the adaptive learnings or online courses are supplementary interventions versus the main interventions. If these are the main interventions, it's very limited, and also not only for the learning itself, but also for doesn't help anything about the non-cognitive skills, right? So they're not able to meet each other. Students are not able to meet each other. So it's also like super limited, not only cognitive ability development, but also for the non-cognitive ability development. So that's my view. And another thing we really have to consider is that like infrastructure in DMC countries. So like as I can, let me share the screens that only like 20% in the lower income countries, only 6%. 6% have internet access and personal computer. It's a better, slightly better countries has 20%. So these are super limited, or like in given this situation is like the online like distance learning cannot or impossible to replace the face-to-face teaching. Maybe I hope everybody agree and understand. Hello?
Thank you, Brian,
Yes,
and thank you, Shin. So I am cognizant of time, and we're past our 1 hour slot. But if there are further questions from the audience, Brian has very generously offered to stay back and answer those questions. But before that, I must formally wrap up this webinar, and we would really like to invite Brajesh Ji, Chief of our Education Sector Group. And after that, Mr. Sung Suk, the director of the Human and Social Development Division for South Asia, to share some of their reactions to Brian's presentation and the discussions that we've had. Brajesh Ji, can I ask you to go first?
Yeah, sure. Thanks, Unika. And let me first thank Brian for excellent presentation. I also like your statement, Brian. You mentioned about that there is no zero risk option. It's all about managing risks also. We are very concerned about the adverse impact of COVID-19. And we have all, mentioned that this has exacerbated learning and inequity. So after about a year of this protracted conditions, it has also had fatigue, and now many parents, teachers, everybody is very concerned. Due to this protracted closing, the accumulated losses have also been very high. So what you have mentioned is now, going to have longer impact for some time. So the good news is that if you look at UNESCO's latest data, many developing countries in the Asia and Pacific region have partially opened schools. There are still some places where schools are closed, but they have opened. So the question is, we need more research on the evolving experience, and this happened, largely after mid-October, and it continues to evolve over time. Also, what I'd like to mention about Dodo's comment is also the readiness of countries and schools particularly, and this is a good opportunity to prepare schools that are not ready, and teacher training in terms of managing, return of students. And you mentioned, Brian, about test scores. Well, in fact, that problem was already there prior to COVID, and we have to find creative ways to embed this assessment, continuous assessment, particularly to enhance learning. In doing that, I think we also need to look at teacher readiness, school readiness, and link to local incidents. For example, Lynette mentioned about giving more support to local governments, because conditions vary, and in many cases there may be no incidents of COVID. So I think we have to employ these methods to go back to schools and provide support. But I also want to mention one last point, that this has also given a big shock to the system, and already a system that was inflicted by poor learning, and we should also tap into some of the lessons we have learned to complement and improve. I think we need to take that very seriously, because going forward, that accelerated pace of improving learning will be the most critical takeaway for us. So with that, thank you very much for a very good presentation. Back to you, Nika.
Thank you very much, Brajesh ji. I just learned that Sungsup unfortunately had to leave. So this marks the end of the webinar. But if there are other attendants that have further questions, then I think, Bryant, we could stick around for a few minutes, say like 2 to 3 minutes. All right. Thank you, everyone. Thank you so much.
Thank you.